More than 27 checks are done during the manufacture of a cartridge. Chemical test on the raw materials and the finished product. Bacteriological controls. Physical checks that the plunger slides smoothly. Leak test to check that there is no leakage from the crimped parts. Cartridge burst test. All ensure that the products are of the very highest quality. Finally, the entire logistics chain for sending out the order ensures complete traceability and an extremely rapid delivery service.
Today I am performing a biopulpectomy on a lower wisdom tooth. To do so, I am going to perform a new anesthetic procedure that involves the use of an eject injector. An eject is a computer-controlled cordless electric injector. It sits in a holder which is also a charger. It is made up of two parts. First, the eject body that has on the front a fixing device provided with a central piston, which holds the second part, that is the cartridge holder. An eject is fitted with two sensors, the so-called safety sensor located on the front and the start sensor located on the top. Injection starts only when you simultaneously activate both sensors. Aspiration is achieved by pressing the lock release button. Now let me show you how to use an eject injector. Insert a cartridge in the cartridge holder. Fix it to the fixing device by pressing the lock release button. A click is heard, confirming that the holder is firmly attached to the body of the injector. Now, screw a standard needle onto the end of the cartridge holder as you would do with any manual syringe. The cartridge holder can freely rotate around its axis so that the direction of the bevel cut can be adjusted to match the direction required for needle insertion into the tissues. On the top of an eject, there are two push-button switches. One to select the injection mode, either auto mode or constant mode. The other to set the speed to low, medium or high. In auto mode, the injection rate gradually increases until the selected speed is reached, whereas in constant mode, injection speed remains constant from start to finish. In the present case, I have set the injection mode to auto and the speed is to medium. Once the speed has been selected, remove the needle cap. Now injection can be started. The grip of the injector is really revolutionary because all your fingers are wrapping around an eject body so that you can start the injection by simply touching both the safety and the start sensors with your fingers. Now you can see drops falling at a slow rate for the first 15 seconds, then at a steady rate a little faster. The feeling of rest and muscle relaxation in the fingers of the hand gives a real sense of well-being. This is due to the fact that no pressure is to be given at any time, unlike any local anesthetic injection performed with conventional manual syringes. You can stop injection at any time by simply moving your finger off the start sensor and resume it by activating that sensor again. At the back of the injector, the blue LED indicator light flashes from start to finish of the injection. The background music that you can turn off gives the patient a soothing feeling by capturing their attention, and is also very relaxing for the practitioner, who almost comes to forget that he is administering anesthesia. It takes approximately 2 minutes to inject a 1.8 mm cartridge. After these 2 minutes, we can consider that the anesthetic solution has spread within the whole area to be anesthetized. Thus, treatment can be started immediately after withdrawing the needle. So now I'm going to start the injection. I insert the needle directly into the ligament because I've chosen to use intraligamentary anesthesia. The computer control of injection makes pressure useless and consequently prevents any potentially painful movement of the needle. Moreover, the solution penetrates at a slow rate. I have selected auto mode and medium speed. Injection starts when both the start sensor and the safety sensor, located respectively on the top and on the front of the injector, are simultaneously covered with fingers. You can see the LED light flashing and hear the background music, which significantly relaxes the patient. The way of holding the injector, which requires no particular training, relaxes the whole hand. This is a real improvement for practitioners compared to conventional manual syringes, which require placing much tension in these hand muscles. The blue LED light indicates that the injection procedure is occurring quite normally. The long beep means that the injection is over. Now, sir, I'd like to ask you a few questions. Did you feel any pain during injection? No, absolutely nothing. Compared to other standard anesthetic procedures that you received before, did you feel any difference? Yes, I've already received many injections, but this time, no pain. I didn't feel the needle. I didn't feel anything. At the end of anesthesia, did you have this swelling feeling as you did following other anesthesias, or was it a different feeling? No, I didn't. I just felt some numbness, as usual. And this feeling of numbness, is it as strong as the feelings you had with other anesthesias, or is it weaker? Oh, much weaker. Thank you very much. I can now remove the old filling quite calmly and slowly penetrate into the dentin towards the pulp chamber. The patient has never felt pain at any time during the procedure, which proves the effectiveness of an eject injector for intraligamentary injections. We can now see the pulp chamber. The procedure to reach the pulp chamber was completely painless, stress-free, and not unpleasant for the patient.
Feature: bevel indicator. Benefit: needle can be inserted into tissue correctly, reducing needle blockage. To prevent tearing of the periosteum, inject with the bevel facing the bone. Feature: finger grips appearing as rings incorporated on the protective barrel. Benefit: wet, gloved hands won't slip. Feature: improved transparency of plastic barrel. Benefit: aspiration is clearly visible. The USP-Inject syringe with its reduction unit, combined with Ultra Safety Plus XL, enables the practitioner to carry out intraligamentary and intraosseous injections smoothly and easily, which normally require strong pressure. The gradual movement of the piston allows a smooth injection, 0.2 mils of anesthetic each time the handle is moved, thus avoiding a brutal and sudden injection. Ultra Safety Plus XL, a sterile, disposable, reloadable, passive and active aspirating injection system for single patient use. Re-engineered to further reduce the risk of needle stick injury. Introducing the safe way to administer Septodent anesthetics. Dental anesthesia is at the heart of Septodent's business, and the responsibility of being the leading manufacturer of the one product without which invasive dentistry cannot be accomplished successfully is indeed taken seriously. But this responsibility goes much further than the provision of an essential pharmaceutical. Clinical research is ongoing, as is the development of new, improved and safer delivery systems. Development that has led to the launch of Ultra Safety Plus XL, the single-use, integrated injection system. Fears on both sides of the dental chair concerning needle stick injury, hepatitis, HIV, CJD and cross-infection in general, along with the increasing demands of patients, mean that more and more dentists are changing to single-use injection systems, and most of those are choosing Ultra Safety Plus XL. After removing the sterile unit from the blister pack, fully insert the anesthetic cartridge into the open end of the syringe. Push finger grip to the end of the plunger, making sure it covers the silicone tip. Support the finger holder from behind with your thumb. Then pushing forward, roll the bull nose of the handle in behind the cartridge. Be sure to see the base of the unit is fully attached to the handle. Slide the sheath protecting the needle backwards towards the handle until it clicks into place, making sure there is no gap between the transparent sheath and the black handle. The click is made as the sheath hits the handle and locks the unit together. A question: how does the instrument lock onto the handle? Inside at the end of the cartridge barrel, there are lips, which when the protective sheath is clicked into place, are crimped behind the bull nose of the handle in the gutter provided. Please note, failure to retract the sheath fully until you hear the click locking the instrument securely may result in the system disassembling during use. Passive aspiration. At the base of the cartridge barrel there is a protuberance appearing as a nodule holding the centered needle that penetrates the diaphragm of the cartridge. At the start of the injection, the diaphragm is pressed against the protuberance. A depression results. Aspiration then occurs. Active aspiration. Obtained by the silicone tip of the plunger handle, creating a vacuum as the practitioner pulls back. The bung follows the plunger tip, providing active aspiration, best observed when a small amount of solution has been expelled from the cartridge. During multiple injection procedures using one cartridge, the practitioner may safely retain the syringe for further use by movement of the protective sheet to the holding position, position A. This should be done whenever the syringe is not in use. Should the system be inadvertently fully locked into position B, no attempt whatsoever should be made to unlock it. Use a new Ultra Safety Plus XL unit. Should you need to insert a second cartridge, follow from step 1 onwards. To complete the procedure and dispose, slide the protective sheet towards the locking position, position B, until you hear an audible click. This has now locked the needle safely in the protective sheath, and the unit can be disposed of and the handle autoclaved. Now that procedures have finished and the unit locked in the B position, separate the unit from the plunger handle. Hold the barrel with one hand and using the other, place a finger in the ring of the plunger handle and pull backwards until the plunger is fully retracted.